Okay, everybody, we're getting towards the closing end of this session, but I think it's very important that actually we get an opportunity just to get a few messages from the very, I think, insightful and certainly it was generating quite a lot of interest and discussion within the small group discussions. And I think it's only fair that everybody gets an opportunity to just get a few of the messages that came out of those sessions and really any other messages about where we should be going in the future if there's anything like that. So I'm very pleased that we've got our chairs here, Christine and David, Laura, Gavin, Karen and May, and I think they have agreed how they're going to get the feedback to you, and then we'll just open it up for a very short few questions from the audience at the end, just so that you get an opportunity to say something else or ask anything that you haven't asked earlier on in the day. So we've got a roving mic here, so I will be, if my technical people are working on this, that this roving mic will move to whoever first is going to say something. So there's no particular order. So who would like to make a stab at?
Hi there, everyone. I've made a lot of notes and I can talk fast, okay? So there's 4 presentations in our grouping. The first was Bernie Kelly and Karen Winter, Sandra Dowling from Queen's, and they were looking at missing voices, the views and experiences of disabled children and young people in care, and look out for it. Their findings are coming out next month. So this is an OFM DFM project looking at the overrepresentation of disabled children in looked after services. Wanted to look at the characteristics and experiences of disabled looked after children, organisational arrangements which vary across the trusts where the needs of these children well met or not. So phase 1 was a literature review where they identified that knowledge was spread across lots of different areas and it was difficult to collaborate. Phase 2 is a survey of social workers and young people, and phase 3 they involve 15 disabled out of home care children, which is a new phrase. They looked at case files, interviews, parents and social workers and senior managers. And they feel it's a unique piece of work because the voice of these young people hasn't been heard before. They used a range of very creative methods to engage, so there was good PPI practice here. So the findings were across 3 different residential settings. So in kinship care, they found lots of very good loving relationships within the wider family. Issues around tied loyalties, reluctance to disclose difficulties, and that the carers who took on this role needed more support at the start, particularly when the children were disabled with complex needs. In the non-relative foster care, there were positive experiences again. Links to the birth family were supported by a social worker, but there were some recruitment difficulties. And in residential care, there was higher need, more issues of out of area placement, some outside Northern Ireland, and it was found to be less suitable placement. And there were 300 children involved, some from short breaks, and some from borderline groups, some with difficulties over getting a diagnosis. There were issues around permanency and change, with a lot of children experiencing frequent moves, new schools, new carers. There was mixed involvement from the participation end, but there were limited choices, and this was explained to the children why. Advocacy and therapeutic support, some had none. So issues around bullying were raised. So there was a unique voice here that needs to be heard, and particularly there were challenges around the mainstream residential placements. And one of the questions that came up in their question time was a very interesting one about the new statutory duty to cooperate. And there's responsibility across the departments. Collaboration can be difficult. So how can this new research actually start to drive that joint up working that will actually help enable the voice of those young people? The second piece of work was Catherine Maguire, and Catherine's an area manager from the Probation Board in Northern Ireland. And she talked about the factors contributing to resettlement outcomes for 18 to 21-year-olds, males across Northern Ireland. So there was a prison review of which there were 40 recommendations, because this was a forgotten group. So this is a community-based pilot. So really looking at what do we know about resettlement outcomes, and the answer is very little. Looking at assistance, what were the situational factors that they can seem very important, but also looking to the bridging and bonding social capital, particularly looking at the issue of transition to 25, which is longer because of folk having been in prison, and that process has been delayed. 162 cases were studied over a 3-year period. Static factors that were looked at were first stage of criminality and usually linked to adversity in the young children, and the younger children who were recalled were 66% of that population, that's the 10 to 14-year-olds. So looking at community and reintegration, issues that came up were around employment. 83% of the pre-sentence report had no employment, no education, no training, so there was a large needs group. Accommodation, most went back to their families, but where would you get that accommodation if there wasn't the family support? And another key one was around alcohol and drug use. So using and I don't know what this is, it's a binomial logistic regression that was used. The main issues were accommodation, number of convictions, and the combination of alcohol and drug coming together. So into practice, looking at for young adults, the transition issues, support on release, accommodation provision, looking at those drugs and alcohol, and having longer term, not short term interventions, and also looking to the community resource of developing social capital there broadly within community development, also looking to supporting the families and giving them the skills to help their young people, and then looking to cross-departmental working, as so much actually divides at the age of 16, 17, how we can lengthen that up to the age of 25. The third group was Diane Boyle, and Diane's senior social worker in the Northern Trust, and she was looking at the roles and tasks of the gerontological social worker, which is a mouthful, and she wanted to look at the work of older people. So she did a literature review looking at neoliberalism, and the things that she identified were lack of money in older people's services, what was getting in the way, deprofessionalisation, a lot of change, a lot of staff leaving. So where could we get some of that ownership? What did we need? Research, education, role clarification in older people's services. So looking at how much we did, how well, were people better off. So she had 100 cases across localities in the trust, and looking at the needs, outputs and outcomes. So she identified a long list, which I'll not read through, but it was quite amazing, all the roles that social workers actually take up. Her one limitation was that she only spoke with social workers, and she would, on active cases, that next time she would like to involve the service users and carers themselves. The social workers, beyond all the roles they did actually deliver on, they would have liked to have been able to do more therapeutic work. And the barriers, which I think are well rehearsed within the strategy, are paperwork, budgets, time, which we all know very well, maybe family issues around capacity, conflict, working with other professionals, and maybe actually challenge from your manager on your own professional practice. What it actually helped people was their confidence in their own skills, their own knowledge, their own values, and good supervision and relationships. So in this 100 cases, 94% were maintained at home, which I think is pretty amazing. Looking to developing some transition support and all those things that were holding them back. She's looking at perhaps developing an outcome tool and involving service users and carers next time. And the final one, number 4, is Helda Snedden with Polly McLennan from Life Start and Deirdre Mann from the Western Trust Safeguarding. So Helga's from an organisation called Outcome Imps, and their title was Changing Practice at the Front Line, Using Action Research to Support Social Work Teams to Implement the Life Start Growing Child Evidence-Based Parenting Programme. So Growing Child is an evidence-based programme which had an RCT last year. It's home-based, a trained visitor comes monthly, and it's from age birth to 5. And it's really development support is delivered to the family, and it's a pilot in the Western Trust. So what is quite unique is that they're using family support workers who are being trained up. So the issue was, how could you scale up what was devised within an RCT to work within a trust? So there was a manual, there was already supervision, the issue of then creating this new professional group, and what was quite unique is that the voluntary sector are training the statutory staff and the issues around that with these new family support workers, full workloads, resources and timescales with the RCT work here. So action research, the implementation drivers were competency, organisation and leadership. So in competency there was coaching, training, selection, and there was good support for this. Organisationally, not always the support, difficulties implementing pathways, and under leadership it was getting the right buy-in. There was inertia at different levels. 1 year on, a lot of learning. It was not what they thought it would be. So what was core? One key worker, regular visits, leadership, having a steering group that has regular data so it can actually steer the group and not to have a delay in information. Your planning and your targets, different levels of leadership and buy-in within the trust. And what I think was unique here, that Hilda is independent, so she could bring challenge to the process, help to move past blockages, and not getting stuck in individual cases. So lots of competing priorities, different eligibility criteria for which families could come into the service, families at risk, care experienced parents, which referrals were appropriate, and looking to long-term planning. And again, I think her learning was that you have to plan and track the implementation and match the families well. Okay.
Thanks, Laura. Just two very general things to add. Two of the projects that were presented in our session were completed as part of the research methods course at Ulster, so it was to reinforce the importance of that course in terms of the bridge between research and practice. And the other maybe general theme was both the complexity but also the importance of thinking how we get these findings into routine practice. That was a really sort of, I suppose, key theme within our session. Okay, thanks. You up for it? Next.
Just to say, I'm not going to go into that much detail because I couldn't remember it all as well. We had 4 speakers, 4 very different speakers, and ours moved from looking at social work training and the critical thinker as social work practitioners, moving on to the developments in the community with positive futures, and also looking at awareness of autism and the training around it and who we need to target. And another one was looking at a training programme for post-qualifying on community development. And I think there was a definite link between the whole lot of it, which was very much looking at how we put the person at the centre of our decision making, how it is their journey, and how they help us develop the services that they need, rather than us choosing to be the experts and decide to develop services that sometimes just don't meet the needs of service users. I'm going to hand you over to May from a service user carer perspective, and she will give you her views on what happened today.
Thank you, and I don't entirely agree with what she's just said. From the service user, well, I'm a carer perspective, and feeling that I needed to respond in relation to the personal and PPI, what's the middle one? Personal and public involvement, PPI aspect. I was nearly going to say political, because that's what it is to me. But I felt that all of the projects, and you've been told ideal what they are, I mean, interesting, community development, notion, critical thinking, that's definitely of interest to me. But it seemed to me that perhaps at the initial planning stages of all of the research, there maybe hadn't been the service user care involvement that there might have been. Now, admittedly, on the training, within sort of academic world, that may not be quite so easy, but is possible. And there are bodies that would, and there are, for example, Laura and I are both in the R&D peer group, I think we call it, which is the service user carer group that focuses on research. So, I mean, there are groups like that where people could be recruited to sit at that level in the planning of research. So just to mention that, because I think it's important, and I'm sure the person doing the lovely research in the Southern Trust won't mind me making the comment that I made, because they had very low uptake. They looked at professionals and various different people's responses to the idea of community development training, further community development training for social workers, and they included the voluntary community sector and actually had them in their initial steering group, but still they had, compared to 70-80% sort of response on the other levels, they only had 8% response from the voluntary and community sector groups. And it struck me that maybe, even though they're perhaps, I mean, I hadn't fully appreciated they were involved at that initial stage, should have done, was in the literature, but anyway. So what was the nature of that involvement? Was it useful? So that the presence was there, because that was a term that our Learning Disability Positive Future people used, from presence to, well, what they have is what was the term they used, from presence to, anyway, to presence to active involvement and effective involvement. So you can have the presence of the service user and carer or the voluntary sector without actually identifying what it is that they could be contributing, and just the idea that maybe that might have helped. I was thinking if I was in the voluntary community sector, I would say, I don't need a community and development course. I mean, what do you think we are? So maybe they needed something else if they want to be part of that. So another point that I think was important to me overall was listening to everybody, responding so much to the need to respond to government policy, because that's what it is, government policy. And so you had personification, you had person-centred care, you had home as the hub, you had how are we going to do this? And it was nearly like, let's find solutions to sort this problem out. Would community development, for example, and I'm not getting at it because I like community development, but would community development help us solve that problem? And that just kind of worries me a wee bit, and especially the reduction of people's lives to terms like that. I'm the mother of somebody with a diagnosis of schizophrenia, and I have seen him come through a system whereby, you know, he spent a whole hospital period painting flower pots that he hated. I cherished them, thinking, oh, my son's brought me home a lovely wee thing he made. He just thought they were a load of rubbish. He didn't want to be painting flower pots. So it's that difference between who decides what it is that's useful activity for you. And sometimes I think that language can be alienating. It can actually separate the professionals from their own experience and expression of problems that might be a bit around those things, but maybe can be destroyed by putting them into a pot of a language of person-centred care. I have to do this. How do I do it? Let's find a solution, instead of more creative solutions coming from your own profession. So just that thought struck me, because I know everybody is dealing with resource problems and with the imposition of new ideas that haven't come from you, never mind from me. So just to say, we're all in that fight together. Thank you.
Thanks.
And I'll start now. I'm just going to start with some general summary, and then we'll highlight who we had in the group, and we'll continue with some more general summary to finish off. I would echo what has just been said, and it came across in the presentations that the people at the sharp end, as I would refer to it, the people who are affected by the research ultimately had not been involved from the start, except in one of them. People acknowledged that that was an issue. People weren't shying away from it. Money was raised as an issue in respect of it. And I think we come back to that if you're going to start any research, from the very start you need to include in your proposal funding to ensure that the people who are affected by that research ultimately, the patients, the clients, the service users, the carers, that they're involved in the design of the research, that you start from that position and that you move through and let them see how the research has had any effect at the end at all. And I think that point comes across in much of what we're listening to, that without the service users, etc., in there, the research is not valid, properly speaking, if the service users aren't being benefited by it in the end. We need to be involved from the start. I'm talking about me as a service user and disabled person, because we need to suggest and advise and say what our needs are. And one of the things that we heard was that too often professionals think they know what our needs are, but they don't. And they will get a much better picture if they ask us and start from the beginning with us. So that was the first point. The second point that came across extremely and quite forcibly in many respects was the lack of interagency working, the lack of interprofessional working, the fact that professionals need to work together along with the service users and patients and clients and carers, etc., in order to provide a proper service for people. It's not going to happen if people don't start to work together. We all know this silo mentality is destructive in the extreme for everybody, both professionals and those in receipt of the service. And we need to try and do something to try and get away from that. It's talked about frequently enough, but it doesn't happen. And somewhere along the line, that needs to change. Research into that and how that can change and how people can work together is vital. One of the points that was raised in respect of that was that individual workers will work together across any various professional areas. It's the systemic problem where at the top, bodies are not working together and not getting things together. And that combined with not having support from the top, not feeling that you are supported to work with other people and so on. So those two messages came across very strongly. I'll finish on one and then I'll pass on to Christine to make one or two more strident remarks maybe. But the final bit was, the question was, the 4 bits of research we listened to were very valuable, I felt. I find them incredibly interesting, very useful, albeit some small bits of research, but could lead on to bigger stuff. But the question is, how did you disseminate that? And not just amongst academics and professionals, but how do you disseminate it amongst people who maybe don't understand academic language? Somewhere there has to be something done to produce stuff like this in everyday clear language, not just for social workers, but for ordinary people as well. And that needs to be thought about too, and that was another point that came out. I'm going to pass to Christine for a couple of final points.
Thank you. As David said, the research or review projects that we listened to were all incredibly useful and interesting. And I think the feature of them was that most of them were initiated and undertaken by people from the workplace. And it was actually something real, that people were working on something that they felt needed improved. So I think that was a very significant feature. In terms of the 4 presentations, 2 people, or two of the research projects were carried out within the voluntary sector. One was in a community development neighbourhood sector, and a PhD student. So we had quite a variety. 2 were about child protection. 1 was in the field of mental health, but particularly about dual diagnosis and a very targeted piece of work. And the 3rd was about actually how do you translate strategic vision into local action. And it was very much an action-orientated piece of research. And I think, I just would make the observation on that piece of work was that one of the messages was, it doesn't always take money, and actually no money was perhaps one of the reasons for its success, and partnership working was absolutely key to the success of that particular piece of work. So I thought those were very strong messages. But 2 other messages that I just want to reflect in terms of the discussion was around hard to reach communities. And I think without exception, the 4 sets of people who were presenting said that the HSC sector was the hardest to reach. And they talked about making great acoustics, but not actually following through in terms of action. Now, we didn't get to debate that in any detail, and I think that would be a very worthy debate, but I do think it is quite chastening when you have people trying to have access to professionals or whatever, that they actually found there were more barriers for them than there were enablers. The other message that I also want to share, which was in the group discussion at the end, was about embedding learning. And I think the general view was there weren't many new messages coming out of the research. They sort of reinforced messages that have come before. So about the importance of communication between professionals, about the importance of strategic leadership, about the importance of organisational culture, etc., etc. And what appears to be our challenge, and I think we know this in social work from inquiries into child deaths, is that the same recommendations come out, but what we can't appear to get over the hump is translating those recommendations into practice and embedding them in practice so that practice actually changes. And I think that perhaps is one of the big challenges for us as we carry out research, that it confirms findings from previous research as well, but yet we're still finding the same findings, which is probably not very good English, and I'll stop at that point. Thank you.
Well, maybe I have to use this. Thank you all to the panel. I think there were some very insightful comments and well summarised. I know it's a tough task when you have been asked to actually summarise such a varied set of presentations, but I think you've all done very well in that, and some key messages and some key challenges out there for all of us. Day is moving on, but I will take a couple of questions. I'm not quite sure who's going to be in the answering seat for any of these, but maybe even just any comments, any quick questions, any reflections that anybody else had. And I say we will only just have a couple of those just so that everybody feels like they've had an opportunity. And we are going to do some podcasts at the end, so if anybody feels really strongly about anything they want to say in relation to today, we would readily welcome you doing that. Larry will organise that at the end. So can I just ask in the group, is there anybody who just wants to comment on anything, or any of the presenters maybe want to reflect or say anything just as a comment back again, or yes, and if you just say who you are as well.
Dermot Glackham, West Belfast Partnership Board. I think your conference has been greatly enriched by the involvement of service users and carers with direct lived experience of issues. So long may that last.
I think that'll be echoed around the room, Dermot. Thank you for that. Can I call anybody else who wants to say anything or make any? Mark, just.
I'm just wondering, as a carer, how you would advise us to involve you, because I suppose it's a bit like us doing things that we think's right. We've tried questionnaires, we've tried doing celebration events, etc., and our uptake has been quite low in terms of the feedback we've got. So in terms of designing stuff and engaging, would you have any tips on what would work in terms of getting service users and carers involved from the start? What would be attractive to them?
That's a really big question. In about 2007, just before the collapse, the Department of Health in England came out with a document that actually tried to record what the different levels of participation, from very, very minimal, just being part of a consultation, right through to maybe a year's involvement in a project, and to actually find a way to, the document was called Reward and Recognition, to recognise that input, and they actually had put monetary, against a reward against each level. Now, that any thought of it, you can't even find that document anymore. I forget the term for it, but you can't find it easily on the website. I just happen to have it from the time. But that's still what it's about. It's the recognition and reward when somebody does it is important, because even if it's not financial reward, because frequently there's problems about your benefits and how you're going to deal with those issues, but actually to be acknowledged for what you've done. I think Laura wants to come in here, so I'm going to let her. Thank you.
Sorry, I forgot to say earlier on that I'm a carer, and I've been a carer for 34 years. And I've been involved in lots of different groups and lots of different levels. And just as May was saying, in your Arnstein's ladder of participation, you can go from basic consulting to co-production. And I think in Northern Ireland over the past 10 years, we're starting to get up that ladder. And different people want to engage at different levels, and it's finding the mechanism where they want to, whether they want to engage electronically, whether they want to come to meetings or consultations. I'll give you one that I'm involved with, the Care Strategy in Belfast Trust, and we have our postcard campaign at the moment, and we'll be able to get a free post on nice postcards, and it's going out through all our teams, it's going down through all our care support groups and beyond, and it is, what's good about our service, what's bad about our service, have you got any new ideas? And it's a way of gauging people who don't come to consultations per se, but it's going down and they're all coded, so we know which teams are coming back from, what are the issues. So it's a way of finding those which are not, I don't call them hard to reach, they're easy to forget people, people who don't have a voice. And the people like me have a voice, and we're very capable of shouting. But it's how do you find those people who don't have that voice? So that's just one simple way. There are lots of different ways, and it's finding what suits that person. Some people may want to be in a project board, be at that level. Somebody might just want to be given feedback within their support group. And the other issue, if you want long-standing engagement of carers, is that if their caring circumstances are heavy, you need to provide replacement care so they can come. And in Belfast Trust, I'm involved in we have a carers reference group, which is representative across all programmes of care. I have my care attendant paid for so I can be there to engage. So there's a cost per engagement. But if you want to hear from those who care the most and who have to engage and who actually deliver the most carers, has been worked out in Northern Ireland. The value, if you had to replace all the carers for 1 year in Northern Ireland, is 4.6 billion. And that's the equivalent of a whole NHS. So the contribution is vital, and it's important to involve those, because everyone looks to, let's find the no-cost or the low-cost solution because of austerity. It's a very low cost to engage those who deliver for free.
Thank you, Laura. Thank you, May. One more, just maybe one more comment from the audience.
The question that what I found really useful for today is that it's demonstrated the importance of having research and having an opportunity to look at how we make decisions and how we involve people to understand their needs better. But I'm still concerned that research that's being done isn't filtering its way down to practice, that there seems to be some kind of buffer that stops it hitting the ground level. And I'm just a little bit concerned that we're trying to change a culture in how we practice, and the likes of, you know, the course in research methods is really good. But I'm wondering, where's the next stage from that? Because are the health trusts on board in terms of actually bedding down real research in people's teams? Because it's not, there's no evidence of ordinary practitioners. It seems to me that we have a professional level of research and then practitioners. And I'm concerned if it's not filtering down, then professionals are talking to professionals, and we're not getting the benefits of that research. And what we're trying to do is to promote the importance of research and evidence-based practice to influence decision making, and encourage people who are at practice to be involved more in actually finding a voice and making change. And I'm just wondering, are the trusts on board with that in terms of actually trying to fund research at that level? Because at the moment it seems to me that the funding is coming from a range of sources, and I'm not sure about how much of it's coming from community trusts.
I'm not sure who is, I think Christy's going to take the mantle here and actually answer that one.
Well, I'll make some comment, and you might want to add to it, Anne, because obviously it's more your area. I would say one of the things that the health and social care system as a whole, the board, the trusts and the department have been very mindful of the need to actually embed evidence-informed practice at practice level and to create capacity for frontline workers to actually engage in not necessarily full-blown research PhD work, but research type work like audits, evaluations, and continuously improve their practice. And I suppose the commitment, I think, from all of the HSC system has been to support the development of this strategy, the Research and Continuous Improvement Strategy, which has an actual plan to try to do some of the things that you're saying. And the other thing, just to say from the commitment from the Trust's point of view, the Trusts actually were the movers and shakers to try to get a group up and running around research to look at what are the big research questions in partnership with frontline staff, with service users, that we actually need answered to help us provide a better service for people and to do that well. And there is a group that's been running now for about 18 months with all of the directors from the trusts to actually put research up on the agenda and look at how we can improve, I suppose, and embed it more with practitioners. And I think the other thing that I would have to say is that all the funding and totally promoting the research methods course and building in research mindedness into all of the professional training for social workers is another key plank to that. So I think there's quite a bit going on, but I don't think we're there yet. And I was actually quite struck by one of the presentations that we heard, was that when people were asked how did they make decisions, what was really interesting, they said gut instinct, and it was sort of learned experience, but nobody mentioned the evidence or the research and actually using that. And I think that's where we've got to get to, that it is gut instinct, it is learned from experience, but it's also what does the research tell you, or what have you learned?
The only thing I would say to that is that there is no doubt that particularly when you look at the research program, which is trying to encourage people to develop the skills in doing it, and that's really important because you need to be skilled, and you need to, and we need to be encouraging people to develop a culture around looking at research. But I'm wondering, that's step one, and we're step two. Where do you go when you've done that course and you've developed that passion in relation to research, and you want to take that forward, and there's no visibility of that at the ground level? And I'm wondering, so do you, it's like I was saying earlier, it's like putting a coat on and then putting it back in the wardrobe. It looked lovely for the 2 years that you did the course, but you might not wear it again for the next 10 years. And that's what I'm concerned about, that really the trust need to have a very clear strategy in how they're going to build on the investment they're putting into training through the research program. That doesn't let it die on the vine. That the skills and the enthusiasms and the motivation they get for staff who engage in that level of training can then move forward in a very clearly set out pathway in which they can both access further research and act as champions within within their teams and within their programs.
Bit of a challenge there, yes. Well, in fact, that is the particular reason why the executive directors and the department actually put their weight behind putting together a social work research and continuous improvement strategy, is for all the reasons that you have actually been talking about, and where do people go. But it's not all about doing research courses. It's not all about learning. We do actually have to all take responsibilities. And I think over the next, we're on a journey. And there's lots of, I'm not sure whether you read the strategy or the plans that are coming out of it. And I think we are building the momentum. This is all part of it. All the evidence, the learning that we take away, how we actually go back into our practices after today and think, you know, I heard something at that. Is there some way that we can actually shape or change? And it doesn't all have to be big, big changes. There can be quite small changes, and I think that was made by the panel. Direction of travel in terms of who's going to be champions. Yes, I think conversations will be going on about that, but we haven't got all the answers here and now, but I think we're on a pretty good journey for making inroads into some of that. So I think just stay with it. I think keep the momentum, and not just I was responding to you, but that's really for everybody in the room. And I think we've a lot of champions in this room today as well. So is that okay? Okay. But I don't know whether you had the strategy. I kind of promote it everywhere I go, actually. But it's more than it's going forward with it. So can I just maybe draw this bit to the end? We're still very much on time, and I only just want a few comments at the end to thank people. But just at this point in time, I just thank the panel for chairing and co-chairing the sessions earlier, and then being able to actually draw some of the messages through from that. So thank you very much for your time for doing that. So thank you. Hello? Can you hear me if I use this? I'm not quite sure how these. Right, you can just, maybe just easier with the panel, unless May, you wanted to do something. No, you didn't have to do anything. You were saying you were caught up with something else? Yeah, it's okay. Well, thank you. Can I thank you for your time? And so I think it has been a very full and very varied programme that we've had today at NICFA. And I do think this venue is actually quite a good venue for interaction and engagement. There's a lot of people in the audience. You've moved around quite a bit. I've heard lots of conversations going on. And that's really, I think, the purpose for events like this. And I really today has done nothing to dampen my enthusiasm for the fact that we should continue to host opportunities for people to come together and engage in dialogue and discussion about things that are actually quite complex and quite challenging, as we actually even heard from some of the comments that were actually raised by the panel. Things are not particularly easy, but by working together, we actually work towards some solutions. But it also gives the opportunity for people to showcase some of their work. And it's always great for organisers to actually look around the room at 3:30 and see so many people still staying with it. There's almost been no one who's actually gone home, gone back to the office, I should say. And those who did have given their previous apologies to us because they did actually have to go. So that's great. So for you who are social workers, and I keep referring to you that are social workers, do remember to claim your PIP awards at the end. People have been asking about it. The messages are starting to get across. It's really about what you really want to do today is reflection on your learning, and then following today's event, you have to have a think about how you're actually going to put some of the learning into practice, which might respond to one of our delegates' questions at the end. How do we do things differently? We all have to do things differently. So Liz and Michael, who you met at reception, will be able to sign you off, because they have to be signed off actually. So claim them, please do. And there's 21 professional in practice credits for those of you who are interested. And when I say Michael and Liz, I mean Michael Cunningham from the Public Health Agency and Liz Conway, who's I see down at the back, from our Directorate in Social Care and Children's. On behalf of Ruth and I think we want to say a huge thank you to both of them, who have worked so well behind the scenes, doing so much just to keep today going successfully. And we will, as I said this morning, email out certificates to all of those of you who are here, but also that'll help those of you who are not social workers. And we will make available the slides from the sessions as well, because there's so much information on them. So when we're organising events, we're always thinking of ways to add in or keep delegates interested and motivated. And I think all our presenters, our chairs, and our panel members have managed to do that quite successfully. And on that note, I just want to, again, say a big thank you to all of you. We appreciate the time and the effort that you've all put together to prepare your presentations and to deliver your presentations. And I think the diverse range of small group presentations based on the submitted abstracts was also impressive, and that has been reflected by the panel. So well done, presenters and chairs, for meticulous timekeeping, and they did blame me for this. They said Anne's going to be on our backs if we don't, so don't blame the chairs if you didn't get all your material delivered. So I think just on that, we'll just do a big round of applause for all of you who presented and chaired and etc. today. So we just give a round of applause for that. And I think conferences and events do need that little bit of fun that Vanilla referred to in her presentation this morning. And I know there's a whole market out there on making your events creative and innovative, but I think our activities were actually very much homegrown. And for that, I do want to thank David Bickerstaff, who will probably shout at me. I don't even think he's in the audience, but David has come up with some of the creativity for ideas for your bingo and the star voting. So hopefully you did enjoy the conference bingo. And I'm not sure whether we had included, what did Joanne refer to, info obesity or info savvy? Not sure we had that on your list. So I'm not sure, did anybody get their sheet filled in? David Bickerstaff. He's not getting a prize. We did say there was a prize for anybody who did. So we're now going to say there should have been 25. I think there's 25 options. If you got over 20, go and see Liz and Michael at reception, and there will be actually a prize of you. Because obviously, if we're not in these things, we're not actually going to win. Just regarding the statements that were actually displayed in the foyer, how many times have we been either at the giving or the receiving end of information that we haven't really understood completely? And David talked about dissemination, clarity, etc. And I think that's a key message that we're trying to get across. It's actually that business about how you give a message and how you receive a message. And I think I had a couple written down in terms of what did they actually say. So if they say that's not bad, it seems to me mean by how you voted that it's probably okay, while quite good means disappointing. So I will bear all your suggestions in mind, and which, as you seem to believe, means I've forgotten them already. That's so. So back to the introductions this morning, and Fionnuala's challenge to think of something that you'd read, heard, that was interesting, observed, or just downright bizarre. And there were some people who left their information, their little snippets on the table. And I said I would read out a couple of those. And if I read them out, there was also a prize. So if your name's called out, you've got a prize. I just refer to Catherine Riley. Catherine, maybe want to? Oh, Catherine, okay. Catherine was referring to a documentary on the television about misshapen vegetables, and referred to the fact that it was a criminal amount of waste by British farmers of the whole issue about misshapen vegetables, because supermarkets and consumers want nicely standardised sized, sanitised vegetables for their dinner plates. So given the amount and levels of poverty in society and obesity and ill health, this, Catherine said, was actually disgraceful and indeed was actually criminal. And there are hundreds and thousands of tons of vegetables are actually disregarded every week. So, well done. And I'm just going to give you a prize for that. I think I have one more here that I think is worth reading out. Marita got her prize, but she left it on the table. Marina McGinnis, who had to go. And she referred to something she'd heard on the news about a young male passes a young homeless man every morning on his way to work. He, every day, had bought a coffee each morning for the homeless man and enjoyed a chat with him, just really about football and about just building up a relationship with him. And at Christmas time, the man, the guy who was going to work, bought 2 football tickets for himself and 1 for his homeless friend. It was his care and attention that actually facilitated the young homeless man to value himself and see how important he actually was, that actually he eventually was able to actually find a home for himself and didn't have to actually sleep on the streets. So the value of a cup of coffee and a chat and an interaction just seemed to be so important in that. So Marita got a prize for that. And Fionnuala, I have to give you a prize. Donald Trump. Anybody, sorry, this will display my politics, but anybody who actually makes reference to Donald Trump actually deserves a prize. So it's off. Okay, Campbell York, I have to mention Campbell. I think Campbell, yes, Campbell here. Hands up. I'm not sure I have a prize for you, actually. Oh, I could give you a prize, actually. Campbell actually has inadvertently become our resident photographer over the last while. So actually, thank you, Campbell, for that. It's always great to have you at our events and helping us out and sending our tweets and all of those things. So those pictures will appear in any future publicity and conference outputs, as will the videos. And I think I do want to thank Lamb Films and the whole crew who I think very discreetly, with so many of you around, actually managed to get a record of the conference today. So on that note, I do want to just say a final thank you to all of you for your participation and engagement, because as I say, when people are still here at 3:30, it's your engagement and involvement that makes events like this actually successful. And to ensure that we continue on the successes, it would be really helpful if you took a few minutes at the end just to complete a very short evaluation sheet. It's not your usual kind of big long one. It's just a few comments that we'd actually like you to make, and then it helps us when we're actually preparing other events. So on that, I wish you all a safe journey back to work or back home again. And do remember to follow us on Twitter. It's been set up for us. So thank you all very much for today.